Good afternoon. My name is Joe DiGirolamo. I'll be your nurse today.
Hello.
Hi. And your full name?
Rose Connor.
And how may I address you? How do you prefer to be addressed?
Rose.
Rose. And your date of birth. I just want to confirm some of your biographical information. When were you born?
March 10th, 1970.
March 10th, 1970. And I understand, correct me if I'm wrong, on the paper here, you're listed under Capital Blue Cross
Yes.
for insurance. Gender, female, obviously. And race, Caucasian.
Yes.
Okay, and then your ethnicity, you stated that you were born in the United States, but you're of Italian descent.
Yes.
Okay, so I must ask, Rose, what actually brings you into the office today?
I kind of have like shoulder pain. I don't know if it's my muscle, if I slept wrong.
Okay, do you mind, as I ask you questions, if I were to take some notes?
Sure.
Okay, great. So you have shoulder pain. It looks like you pointed to your right shoulder. Is that correct?
Yes.
Okay, and when did this pain start?
Like 2 days ago.
2 days ago? What do you believe brought the pain on?
Well, I think I slept wrong because when I woke up 2 days ago, that's when I felt the stiffness.
Okay, so you have a combination of pain and stiffness that started 2 days ago, and you believe you slept the wrong way on that side. As far as if the pain radiates anywhere, does it travel anywhere besides the neck area and the shoulder?
No, it's just about like from here to here, like that's why I'm thinking like I slept wrong with the pillows.
Okay. With that being said, on a scale from 0 to 10, right now, how would you rate your pain? 0 meaning no pain at all, 10 the worst pain ever.
Well, I took an Advil before, like maybe like 2 hours ago. So right now I would say, like when certain way I move my head, it would be like a 2. But the Advil is helping me.
Okay.
Without it, this morning when I woke up, I would say it was more like a 4.
Okay, so without any medication, you're giving a rating of 4 out of 10, and since you've taken the Advil this morning, it's now down to 2 out of 10, and I understand that certain ways you move, it actually aggravates the condition,
Yes.
makes the condition worse. How much Advil did you take this morning, and at what time did you take it?
I take it like as needed. I probably took it around, probably around 9 a.m.
Okay, and how many milligrams or tablets or capsules did you take?
Just one.
One, so 200 milligrams. Okay, and this started 2 days ago. The pain that you're having, is it intermittent? Is it constant?
No, I would say like only like when I turn like a certain way like this, I can feel a little bit more.
Okay, so it's just occurring during certain movements.
Yes.
How would you describe the pain? Is the quality of the pain, is it dull? Is it sharp?
Well, I would say like it's not like, it's more like tightness.
Tightness, okay.
Like it's not like a sharp pain or anything. It's just like feels like maybe a kink, maybe.
Okay, and besides the Advil, had you done anything else to alleviate the pain?
I showered this morning and I left the hot water run on my back, and that really made it feel like loosened it up a lot.
Okay, excellent. With that being said, had you ever sustained injury to that part of your body, or have you ever had any surgery to that part of the body? No. Okay, what I would like to do now is get into a little bit of your past medical history, your general state of health. How do you perceive right now your overall health?
I'm pretty healthy.
Okay. Have you had any past medical illnesses or issues at all?
I did have breast cancer in 2013,
Okay.
and I had a mastectomy done.
All right. Now, in 2013,
It was
With-
December
it-
2013.
December 2013, was it just one side or
Both.
both? Okay.
And I had reconstruction
Okay. So you had
the
surgery.
following year,
Okay.
which would have been March 2014.
Excellent. With that being said, had you received any other type of treatment, chemo, radiation?
No, I did not have to. I am on tamoxifen, which
Okay.
is it's a estrogen blocker,
Yes.
and
How many? What is the dose of tamoxifen that you're taking?
it
or
is
prescribing?
I think it's 2. I'm not quite sure.
Okay. Well, what we can do is, do you have the bottle on you at all, where we can look it up? And if not, what we'll do is I'll just list
Oh,
it.
you know what? I think it's 25.
Okay, 25.
Sorry.
Okay, excellent. And we can reconfirm that then at a later date. With that being said, do you have any other medical issues, illnesses, complications?
No, not at this time.
No diabetes, heart disease, or anything like that? Okay. How about injuries? Have you ever had any fractures, broken bones?
Never.
Trauma sustained?
Never.
No. Hospitalizations besides the issue with the breast cancer, the mastectomy. Have you ever had any other hospitalizations?
1988, I had a baby. Had a
Yes.
pregnancy, and I had a C-section.
Okay. All right. That being said, in addition to the C-section, the mastectomy, the reconstructive surgery, have you had any other surgeries such as tonsils removed, tube placement in the ears, wisdom teeth removed?
Never.
No other surgeries? Okay, and as far as your cancer, is it in remission? Has it been eradicated?
Yes, everything's good. I go for checkups twice a year,
Okay,
and it's been 5 years now, and everything's been great. I mean, I couldn't ask for anything else.
that is phenomenal. And where do you actually go for your checkups?
Sloan's Kettering?
In New York City.
Yes.
Very nice, excellent. Do you happen to have any allergies, whether it be seasonal allergies to medications or environmental allergies such as dust, pollen, animal dander?
No, nothing.
No known drug allergies? Okay. Do you currently smoke tobacco, or have you ever smoked tobacco?
I have in the past. I would say probably like 30 years ago.
30 years ago, and had that been cigarettes?
Yes.
Okay, and how many packs a day did you use?
Oh gosh, I don't remember. It's been so long.
That's okay. I'm so glad to hear that you haven't used tobacco products in 30 years now.
Yes.
That is
I'm happy
phenomenal.
to.
Do you use any recreational drugs or street drugs, including marijuana, heroin, methamphetamine, anything along that nature?
No, I do not.
Okay, had you ever?
I have already tried. I tried marijuana like when I was in high school.
Okay. And how about alcohol? Do you consume or drink alcohol?
Oh, no, I don't. Just like very seldom, like around the holidays.
Okay, so socially, and what do you normally have to drink? Wine,
It
beer?
depends on who I'm with. You know, if everybody's drinking wine, I'll have a glass of wine.
Okay,
If, you know, sometime I'll just have a beer.
all right, excellent, not a problem. The other thing I wanted to ask, you know, electronic cigarettes are real big, vaping is real big. Are you using any of those products at all?
No,
Okay,
never.
great. All right, so
I'm kind of away from all that nicotine. That's many, many years ago, so I don't, you know, I have no interest in smoking ever again.
that is excellent to hear. And exercise, regarding exercise, do you exercise?
All the time. I'm really healthy about everything, eating well, exercising, and yes, I exercise probably like every day,
That is excellent.
even if it's at 15, 20 minutes,
Perfect.
whenever I have time.
That is phenomenal.
I always feel like if I can eat, I can do a little exercise.
And you know, the Centers for Disease Control, the American Heart Association, recommends you know, moderate exercise, up to 30 minutes a day, you know, preferably 5 days a week. And you're exercising every day, and even if it is for 15 minutes,
Or 5 minutes, I do something.
that's excellent. If you want to keep moving, you gotta move. There's that old
I
adage.
like to stay busy.
And you saying that your eating habits are good, or you know, well balanced, nutritious meals.
Pretty much, I try to eat lots of vegetables and fruits, and you know, eat a nice breakfast in the morning. I always try to make like an egg with asparagus, and then later on, I try not to eat after 5. Also, I try to eat my meal before 5, and then if I get hungry later on, maybe I'll have like something like salad or fruit or carrots or celery. I try to, you know, just so I'm not, you know, hungry. I drink lots of water.
Excellent. And you try to limit your saturated fats, your sodas.
Oh yeah, I don't drink soda.
Okay. And also try to limit your salt intake as well.
Yes.
Excellent.
'Cause we have enough salt in our food, I think.
Okay. And how is your sleep? And that is so true, especially with you know, the fast foods, the sodium content. You're so right.
I don't really go out to eat either. I cook my own food, so I feel like it's healthier to eat home
That is
because you know what you're eating.
I agree, but I myself sometimes violate that and have some fast food from time to time, unfortunately. As far as your sleep, are you having any difficulty sleeping? How about how many hours a night
I probably
of sleep?
sleep like 5 hours a night, 6 hours. I work 12-hour shifts.
Okay.
I work at a hospital, so I'm a tech on the floor, so I'm pretty busy running up and down. So I get a lot of exercise at work.
Excellent.
Sometimes I get like over 1,000 steps in. I kind of always like, sometimes I have like my phone tells me how many steps, so I kind of get pretty much exercise at work.
That is excellent. And with that being said, because you're so busy, you know, I would imagine providing direct patient care.
And like I said, I work 12 hours, and times I get home and showered and everything, I probably, time I go to bed, it's like 9:30, so I probably sleep till like 4:30, 4:45.
And do you feel that that's adequate sleep for you? Are you overtired and work at all? Is it
No,
affecting?
because when I do sleep those hours, I get a good sleep.
Excellent.
I sleep good. You know, I'm like pretty much sleeping. I'm, you know, like get a good night rest.
That is perfect. Getting back to medications, you said that you're on tamoxifen. Are there any other prescribed medications that you're taking?
Oh, I'm also on, I'm hypo, so I am on, it's a pill I take in the morning when I wake up. I take it half an hour before I eat. It's,
Is it
Synthroid.
Synthroid. Okay.
I take that.
Okay, so have you been diagnosed with hypothyroidism then?
Yes.
Okay, and you take Synthroid in the morning before breakfast, at least a half hour.
Yes.
Okay, with that being said, how many micrograms do you know offhand?
25.
25 micrograms.
And I'm just thinking now.
Yes.
My tamoxifen, I think it's 2. Does that sound, I think it's 2 grams.
Okay.
2.
Okay, I am going to check that, and then,
Okay.
of course, what we can do is reconfirm maybe at a later
Right.
date, or
Right.
I'll even, maybe you can give the office a call,
Sure.
and we can update that.
Sure.
Do you take any vitamin supplements or herbal remedies at all?
I do. I take a vitamin D3 because my vitamin D is a little bit low. I
Okay.
take like I think 2,000,
2,000 units,
and
okay.
then I take calcium with that, which is 5,000,
5,000, okay.
and then I take a multi.
A multi-vitamin?
Yes.
Okay. And you said that you do not have any allergies to medications?
Nothing that I know of.
Any dyes or contrast, anything like that?
Nothing.
Okay. How about your vaccinations? Are you up to date on vaccinations?
Pretty much so. Like I said, I work at the hospital, and they pretty much, when I first started, and I got a few shots.
Okay, so let me go over. Is your tetanus up to date?
Well, I'm probably due for that.
Okay, so you're over. You may be due for tetanus.
Yes, for sure.
Okay, as far as your, let's say, a lot of times in a hospital they'll require hepatitis B. Did you get these shots when you were first employed?
Yes,
And what year was that?
oh gosh, I'd say 1992 maybe.
1992. So this hepatitis B, 1993?
Yeah, something
Okay.
like that, 2 or 3. I don't really remember.
Okay, so with that being said, does hepatitis B vaccine sound like one of the vaccinations?
Yes, hepatitis B, AG, I think.
Okay.
Asian.
And how about the MMR?
Oh, I had
Mumps,
that.
measles, rubella. You did?
Yeah, probably like years and years ago.
Okay. And how about the vaccination for chickenpox, varicella?
Probably had that all when I was younger, when I was a child.
Okay. And anything else that you'd like to add to the vaccinations?
Yeah.
Okay. As far as your frequency for doctor's visits, like your routine care, your physicals, how often do you...
I'm pretty good with that. I'm pretty much up to date with all my like my GYN. I do that every year.
Okay, so that's yearly. And
Yes.
your routine physicals, do you do that yearly
Yes, I
as
do.
well? Okay. How about your eye and dental examinations?
Absolutely.
Yearly for eye?
Yes.
And do
My
you
dental, I go every year,
every year, do you go once a year or twice a year?
twice a year.
Twice a year. Okay, excellent. And do you wear seat belt when driving?
Yes, I do.
Okay, excellent. And also it's very important, a lot of people don't know this or overlook this. It's very important when you're driving to keep your hands at either the 2 and 10 or actually preferably the 3 and 9 position, and keep your thumbs outside the steering wheel, because
Okay.
God forbid if there's ever a collision and the airbag goes off, it could actually damage or break your thumbs.
Okay, I didn't know
Are you on any specific diets at all?
that.
You said that you eat healthy.
I just eat healthy.
Okay.
I eat everything, but everything at a moderate.
Okay. Is there anything that you're unhappy with in life that you're trying to change?
No, I don't have any complaints.
Okay. Getting into some of your work environment,
I just want to say one thing,
yes,
excuse me.
please.
Colonoscopy, I
Oh.
go for that every year too. I just want you, not every year, like, I think whenever I'm due again, I just went like, just October of 2017.
2017 for the colonoscopy.
Yeah, so I go like, I probably won't have to go now, he said, for like another 5 years.
Okay, excellent. Very good. I'm so glad that you're so proactive in the management of your overall
try
health.
to.
That's impressive. You said that you work at the hospital, that you provide direct care as a technician, and your work hours, do you work first, second, or
I work
third shift?
12-hour shifts.
12-hour shifts.
So it's, it's like 3 1 week, every other weekend, and 2.
Okay, and what time do you start and end your shifts normally?
7A to 7P.
Oh, okay, so excellent, 7A to 7P. And obviously there's a lot of hazardous material in our environment. Are there, and loud noises, in your specific work environment, what specifically presents itself as a hazard as far as chemicals or materials, or are you exposed to like frequent radiation? What are some of the things that
Sometimes some of the patients, we have to wear gowns and our gloves and our mask.
Okay.
Some of the patients are, they have different stuff that's going on, like
Different infections and
Infections
things that may be contagious and so
Yes.
forth. So you're wearing you're
protecting
gowning up
myself.
and wearing the necessary mask
Yes.
and goggles and gloves.
Yes,
Okay, that's
absolutely.
great to hear. What are some of your hobbies?
Like I said, I exercise. That's my big hobby.
Excellent.
I like to read
Good.
about different foods and exercise and gardening. I like to work out in the yard. I like to learn about new plants, and I like to swim. I like to ride bike. Wintertime, I like to go ice skating. I try to not to really sit around. I'm not a person to sit around. I have like nervous energy.
No,
Like
that is excellent energy. That I'm very impressed. And have you traveled overseas anywhere?
No, never.
Never. Okay. The other thing that I'd like to talk about is really your family history. Do you have any relatives, and by relatives, relations that are very close, first line family members, mother, father, brother, sister, first cousins, or children that have any chronic conditions or medical issues or diseases?
Well, my father, he was diabetic, and my mother was in between diabetic, just starting,
Okay. Pre-diabetic?
pre-diabetic.
And you use the term was. Are they still living?
Both of my parents are deceased.
Okay. And when did your father pass away?
My father passed away February 7th, 2015.
2000.
And my mother passed away October 2013.
Okay. And any other medical issues with mom or dad besides the diabetes?
Well, my mother had lung cancer,
Okay.
and my father had, it was something with his heart. You know, he had a heart attack, and
I'm
yeah.
so, I'm sorry. And as far as brothers and sisters, do they have any health complications at all?
Well, cancer is like really, like a lot in our family. I had a younger brother that passed away. He had leukemia, and he, you know, that was probably like in like 1971,
1971.
and I had two half brothers. One had lung cancer, and the other one had brain cancer. He had a brain tumor.
And what years had they passed?
I would say my brother with lung cancer was 1996,
1996
and my brother was 2014.
and 2014. And as far as you said, you had a C-section.
Had a C-section.
Delivered a
A
baby,
son.
a son.
I have a son.
Does he have any medical issues at all?
My son has autoimmune hemolytic anemia.
Okay.
It's like a blood, something with the blood.
A blood disorder.
Yeah.
Okay. As far as your spiritual being and your psychosocial being, I'd like to ask you some questions. So tell me about yourself, your upbringing, how you were raised, and
Mother, father, brothers and sisters. We, you know, always helping out in the house, and my mother always cooked, and that's why I probably cook and don't really go out to eat. My father, we'd go out on Sundays. He'd take us out to the restaurant to eat, and he actually had his own business, so we used to go up to his office, and you know, sometimes we used to play secretary at his desk, and I had a good upbringing.
it sounds like you have a lot of nice, good memories there.
We
And
had close
a lot of
neighbors,
nice
and everybody was
experience.
like family. And my grandmother lived up the street. I used to go there and spend time. And my cousins, used to go to my cousin's house, and he was a big. He played tennis all the time, so I'd go over there, and we used to go over to the school, to the tennis courts, and play tennis, and
very,
swimming all the time. We always had a pool,
very nice.
so we were always swimming. There was always kids over the house, and
Very nice.
Mhm.
Now, are you? I wanted to find out about your marital status and your support network, like with friends and so. With that being said, what is your marital status?
I am single.
You are single. Okay. So, with that being said, you raised your child
Yes.
by yourself.
Well, I lived with my parents for a little bit,
Okay.
so they were my support.
Excellent. And so you had good family support.
Yes.
And how about support from friends as well?
And I have lots of friends.
Excellent. Your overall perception of life, satisfied, dissatisfied?
Very satisfied. I don't have any complaints about where I am today.
That is excellent. Religious beliefs, what religion?
I'm Catholic.
You're Catholic, and do you pray and meditate?
Yes, I do.
That is excellent. The next area that I'd like to ask you questions on concerns sexual history. Is it okay if I ask you questions?
Sure.
Your perception of sexuality, do you view yourself as a heterosexual, homosexual, bisexual,
Heterosexual.
heterosexual, and your frequency of sexual activity.
I'm not, I'm not
You're abstinent at this time?
at this time.
That is fine. And your first experience was at what age?
19?
19. Have you ever had any sexual problems or sexually
Never.
transmitted diseases? And obviously you're abstaining, so I'm assuming that you're not practicing any risky sexual behaviors.
No, I am not.
Okay, and when you do, it's safe?
Yes, absolutely.
Okay. Do you have any history as to any sexual abuse?
No, I do not.
And no instances of rape or anything
Never.
of that nature? The number of pregnancies, I know you had a C-section, you delivered a boy. Have you had any other pregnancies?
No, never.
And okay. Are you currently having your menstrual cycle?
No, I'm actually on estrogen for the cancer, so
Yes,
that's
the
like a block.
tamoxifen.
Tamoxifen puts you into like
Menopause?
menopause, and my
What-
period stopped probably like 6 months after I was on the tamoxifen, 2013.
2013. Excellent. What I'd like to do now is just briefly go over your bodily systems. Have you had any unexplained weight loss? Do you have any night sweats or fatigue or weakness?
No, just the hot flashes from the tamoxifen, which makes it worse.
Okay, and as far as your eyes, any visual changes,
No.
issues with eye pain or double vision,
Nothing.
blurred vision?
Nothing.
Ears, any problem with hearing, ringing in the ears,
No.
stuffiness?
No,
How about any sinus pain
never.
or sinus congestion?
Never.
Any bleeding of the gums or toothaches?
Never.
How about throat pain or difficulty swallowing? Okay. Heart related, have you had any chest pain or shortness of breath ever?
Never.
Any intolerance of any of the exercises or activities that
No.
you're performing?
None at all. I just go, my pace and
Excellent. And how about any swelling or edema in the extremities?
never.
Okay. How about coughs or wheezing?
No, I
Nothing.
don't have any of that.
Regarding gastrointestinal, any abdominal pain,
Never had any problems there.
diarrhea, constipation,
No,
nausea,
No.
vomiting,
no.
urinary tract?
Never had a urine tract infection.
Okay, and how about any urinary frequency or difficulty emptying your bladder?
Never have any problems there.
Any pain?
Never.
Okay, or discharge?
Never.
Excellent. Your muscle and skeletal system, besides the right shoulder pain and neck pain that you're experiencing right now, do you have any issues?
No, I don't have any at all. I just, like I said, I think that's from the way I slept.
Okay, and then as far as your skin, any rashes, bruises, cuts, scars,
No, I
any
do not.
moles changing colors?
Nothing that I know of. I just had gone and I had my whole body scanned and
Okay.
everything was good.
Okay, and any changes in smelling or any seizure-like weakness in the limbs or
No.
extremities, tingling or numbness?
Nothing.
Okay, and do you have any anxiety or depression?
No, never.
Have you ever felt like killing yourself or hurting
Never.
yourself?
Absolutely not.
Have you ever felt like hurting or killing others?
No.
Okay. And then you said that you don't have any night sweats, but do you have any abnormal thirst sensations?
No.
And you said you don't have any urinary frequency?
No.
Okay. How about, have you ever been diagnosed with anemia, or do you bruise easily?
No. None of that ever.
Okay. And if you were to receive a cut or a scrape, do you have a hard time controlling the bleeding?
No, I wouldn't.
Okay. And then lastly, you said that you don't have any environmental allergies, so you never
Nothing that I know
had a
of.
bad reaction to
No,
anything
never.
that. Okay. All right. With that being said, what I'm going to do is we're going to take a close look through the physical examination at your shoulder and neck, and then we may do some diagnostic testing as well, depending on the outcome of that physical assessment, maybe possibly an X-ray. Is that okay?
Yeah, that's fine.